Hello everybody. It is said, a smile is happiness you will find right under your nose. But if your nose is fat, bulbous, small, crooked, humped or deviated or parrot shaped, your smile gets lost. Hello everyone, I'm Dr. Ashish Khare, consultant plastic surgeon at Cosmetic Aesthetics, Delhi and Gurgaon. And in this video, I will highlight about the nose correction surgery or the rhinoplasty. And do watch till the end to know everything about the nose job you always wanted to know. We at Cosmetic understand how important it is to wear confidence on your face all the time, and even a bit of body shaming can pull down your confidence. People who develop low self-esteem because of their nose shape can go into depression and restrict public meetings to avoid any jokes on their facial asymmetry. They spend a lot of time worrying about its shape and size, as the nose is central to the face and defines the complete face and gives a new meaning to your face. Due to the evolving science, we now can get close to our desired shape of the nose with the help of corrective surgery by a good plastic surgeons. Again, it is a specialized surgery and should be done by an experienced plastic surgeon only. Let us understand a few facts about this surgery. Also subscribe to our channel Cosmetics for regular plastic surgery videos. Now, let's discuss what is the nose correction surgery or the rhinoplasty. Rhinoplasty is a cosmetic surgery to correct or improve the size and shape of the nose. It usually involves readjusting the cartilage and the bone of the nose to make it more symmetrical and harmonious with the face. The nasal tip may be redefined to make it more defined. What are the various techniques for rhinoplasty? There are mainly two techniques, the open or the closed. These are often decided by the surgeon about which approach to be followed. What one should expect at the time of initial consultation. The patient should feel free to communicate with the surgeon about what are the problem areas for him and what are their expectations from the results. Then comes the role of the surgeon, evaluating the patient. Surgeons usually analyze the nose in detail, whether you need augmentation, reduction, narrowing or projection or septal deviation correction. Sometimes only tip corrections may be required. Different permutations and combinations are usually required for a rhinoplasty or a nose job. The surgeon would help you understand the approach and technique, the result which can be attained through surgery and the recovery time. An individual plan is made considering your realistic expectations and specifications. Patients should understand that sometimes their expectations may be unrealistic and they should completely agree with that doctor before going ahead for the surgery. Pre-surgery nose pictures would be taken from different angles, and by 3D effect and computer tomography, we can show you exactly how will be the post-operative expectations or the results, the desired or realistic results, I would say. Now, what are the preoperative instructions? Preoperative instructions are very important and contribute a lot in providing good results later on. If a patient is a smoker, smoking should be stopped a week before the surgery for better results. Any blood thinners need to be stopped before the surgery. Required blood test and imaging of the nasal cavity should be ordered. What to expect on the day of the surgery? As this surgery is done under general anesthesia, 8 hours of absolute fasting is required. This surgery usually involves one night admission to the hospital as nasal packing is done on the day of the surgery. Consent is taken for the procedure and the patient is shifted to the OR room. What is the procedure like? If the open approach is followed, an incision is given on the underside of the nose. This usually gives a better surgical view, hence is the preferred approach. There is a small transcolumnar scar which fades away with time. If the endonasal approach is finalized, an incision is given inside the nose, hence there is no external scar. This approach allows only minor changes in the nose. If there is an excess cartilage, it is usually trimmed off, but if deficient, can be taken up from the ear or the rib, also called as the costal cartilage. These are taken from the scars which are easily camouflaged and usually not visible. Accordingly, bone is also chiseled or restructured depending upon the requirement. Sometimes, in recent past, we were using silicone implants, but now it's not usually preferred for nasal augmentation surgery because of the implant extrusion, which is very much common. You may have a nasal packing on day 1, which is usually removed after 24 to 48 hours. How much is the recovery time following rhinoplasty? Usually a week is required for the pain to subside and the dressing to be removed, post which office can be rejoined. What are the immediate complications a patient encountered after the nose job or the rhinoplasty surgery? The most probable complications just after the surgery are minimal pain, bruising, swelling, edema, or the nasal stuffiness. Once the pack is removed, the patient can breathe normally and the swelling subsides in 7 to 10 days. How much time does it take to show the final result? Rhinoplasty surgery results take time to show off. After the dressing removal, you may still have 60% of the swelling of the nose. Final results may take up to 9 months as edema takes time to settle down. One should have enough patience for this and understand this before giving consent for the surgery. Tip definition repair needs maximum time to settle down as the maximum swelling is found around the tip and it is the area which takes maximum time to give the results. Some patients come to me when they get their rhinoplasty done either by me or someone else and they are not happy with the results. They want some more changes and the results are not according to their expectations. These patients sometimes lose patience and they do not want to wait for more time to see their final results. As I have seen them asking for second or a revision or a corrective rhinoplasty. I always counsel these patients and tell them, don't ask them to wait for at least a year before considering the option of resurgery because the edema takes time to settle. So I always consult and counsel the patients that please at least wait for 1 year, give some time, give your nose a rest before considering or going for a corrective rhinoplasty or a nose job. The patient should have a patience. They should wait before going for a resurgery. The non-surgical rhinoplasty is a nose correction done through fillers or fat grafting and can be used to smoothen out the deformities of the nose or add volume to the deficient area. It is often called as liquid rhinoplasty. This method is becoming very popular as people find going under the knife scary sometimes. It is faster method often known as 15 minutes nose job. Though a safe and effective method, the procedure needs to be repeated after a few months. It's a temporary method of nose correction, but it has to be repeated after some time as well. So friends, key point of our discussion today are a nose shape is important to define a facial contour as it is the center of the face. Nasal correction should be made in combination with your plastic surgeon as sometimes expectations of the patient may be unrealistic. You should accept this and if going ahead with surgery, you need to have patience. Final results may take up to 1 year. If not happy with your results, you should wait for at least 1 year. Last but not the least, your first rhinoplasty surgery is the most important surgery. So be aware of the fact and choose your plastic surgeon carefully. Hope you like this video. For more videos, kindly subscribe to our channel Calosa Cosmetics. You can also log onto our website calosaaesthetics.com and calosa.in. For more information, we are also present on other platforms like Facebook or Insta and Quora. So stay connected to keep viewing our results and more plastic surgery information and results. Thank you.